Hello, in this video we will be discussing an interprofessional educational program called IEE. You might be thinking, what is IEE? IEE is the acronym for Interprofessional Experiential Education for both those in their academic training and those new to the field of practice and caring. This is interprofessional education that is not taking place in a classroom setting. It provides timely education and support while individuals are working, not while they are thinking about working. This is education that takes place in the context of the workplace, introduces timely information, and encourages and supports reflection on practice. IEE is important because it involves the intentional coming together of people from different professions. It encourages holistic perspectives that support integrated care. It cultivates the practice of self-reflection and praxis, which is the application of theory to practice. IEE provides a support system and ongoing education. I'm Caitlin Kwan, a recent nursing graduate from the University of Saskatchewan. I did my 4th year preceptorship at Sherbrooke Community Centre here in Saskatoon.
The purpose of this project was to rekindle interest for working in long-term care due to the recently increased barriers in addition to the COVID-19 pandemic. Some of these barriers include workers seeing long-term care as unchallenging, social devaluing of working with older adults, and the misconceptions about choosing long-term care as a career choice rather than a last resort. Some of the goals include alleviating a sense of being alone as learners, developing confidence and deep respect for the life experiences of older adults, and to instill a sense of community.
My name is Deju. I just recently graduated from the University of Saskatchewan College of Nursing. I did my preceptorship at Transitional Care Unit at City Hospital.
For 13 weeks, participants explored various resources pertaining to caring for older adults. Voluntarily, they met with team members weekly for 30 to 40 minutes in order to discuss the resources and share their thoughts and ideas. These resources focus on the following topics: kind and clear communication, nutrition, advanced care planning, medications, spirituality, palliative approach to care, and many more. All resources are available to participants in the IPECT system. This project supports learners caring for older adults and connecting them with essential philosophies of care. Learners are able to develop a better understanding of the backgrounds and disciplines of their interprofessional team members. This is to help facilitate a more productive and collaborative environment.
I'm Sukhmani and I have recently graduated from College of Nursing at UFS. I had my 4th year preceptorship at Convalescent Unit, City Hospital.
I'm Devin. I'm a 4th year pharmacy student at the U of S. I just finished my clinical rotation at the Geriatric Day Hospital program at City Hospital in Saskatoon.
The reason I decided to partake in and help lead the IEE program is because I have a special interest in long-term care and caring with older adults and their loved ones. Out of all my clinicals in nursing school, I have loved all of them involving older adults, such as those in mental health, med-surg.
I decided to participate in the IEE because of my interest in caring for and supporting elderly populations and their caregivers. I like to be incredible, and for me to be more incredible, I need to learn and grow. I need to be in an environment of people who can support, and that is what IEE does. Just being in an interdisciplinary setting, it has also helped me to be more incredible, enthusiastic, passionate about providing care for the elderly population. For example, communication is one of my big things. We had a model on kind and clear communication. Listening more than speaking. It's giving me the platform to continue to grow, establish sustainable relationships with other team members.
I chose to take part in IEE program because I wanted to get more comfortable working with older adults and specifically an interprofessional team. Providing them holistic care would have been impossible in the presence of interprofessional team. I worked closely with physiotherapists, occupational therapists, First Nation services. By working with them, I was able to provide them the best possible resources.
I decided to participate in the IEE program as elderly patients are more likely to have complicated medication regimens and often benefit from having their medications reassessed by a pharmacist to ensure efficacy and safety. The program allowed me to learn a few specific tips and tricks that I can apply in practice. For example, the palliative care unit helped me understand the role of pharmacy and how caring for patients often transitions from treating conditions to making patients comfortable before they pass away.
Partaking in the IEE program has benefited my nursing practice, as with each module we covered, I was able to apply it to my clinical practice in Sherbrooke. For example, when we covered the oral health module, I asked my peers about their experience with oral health in their clinical area and how they promoted it in their health facility, and how we could also improve it together. I feel more confident, competent, caring with older adults and their loved ones.
IEE has helped me to understand and acknowledge the roles and expertise of each member of the interprofessional team. It has helped me to get comfortable in building the relationships with each member and understand where they come from.
I believe that this program can benefit others, as interprofessionalism is very beneficial for patient care and an overall work environment. Understanding the role of every profession and how they can view patients can be beneficial in a team environment.
This program is applicable in all clinical settings. It is indeed a lifelong education. Working with the elderly population in a long-term care can be fun and can be very fulfilling.
Practicing together, thinking we are not alone in providing holistic care is a blessing. There is need for more of we practice than I practice.